working with Nancy. Nancy is here. We've been working on Nancy's left foot for plantar fasciitis, and I'm going to walk you guys through on how we actually stripped out the muscles to help Nancy to walk better, especially in the morning, right?
Yes.
When you get up in the morning. So
Absolutely.
I'll have Nancy tell you guys some symptoms and her history with the left foot.
It was probably about 8 months ago that I started feeling the pain, and I really waited too long to come see Dr. Chip, but I probably went for 5 or 6 months with a lot of pain, not being able to walk at all, not being able to do anything really, and I couldn't find the right shoes. So I finally came to see Dr. Chip, and he's been working on it now for,
I'm going to say 3 weeks, 4
I was
weeks?
going to say about 3 or 4 weeks, and
Mhm.
just really stretching it out, so it's much, much better.
Than what
It's
it was.
great.
Okay.
It's great.
So also today too, right before we work on her, we're actually going to show you guys how to stretch out the Achilles tendon and also the calf muscles to help assist with keeping the muscle and the fascia loose, so that the symptom doesn't come back, and at the same time it keeps the functionality in the foot and ankle. So that's the first thing we'll have you do. So let's have you stand up for me, Nancy. And so the first one that we're actually going to show you guys how to do, is to actually stretch the calcaneal tendon. Okay, the calcaneal tendon, of course, is down here further, right below the calf. And the first thing we'll have Nancy do is put the left leg back. Okay, so that's the one that you're going to be stretching on. Okay, so I'm going to have you move back just a teeny bit further for me, Nancy. So there's 2 ways that we actually have you guys do this. The first one to do is when you lock the knee, we're keeping the knee straight here, Nancy.
Mhm.
And all we're going to have Nancy do is lunge forward with her forward foot and leg, and then push back with the heel, keeping the knee straight. And what that does is stretches the gastrocnemius out and the calf muscles, and that's going to help to relieve the tension in the calf and a portion of the Achilles, particularly the upper portion. Now, what we have her do is after that, I usually have patients hold this for 30 seconds or a minute to stretch out.
It
right?
burns.
And it does burn, right, Nancy?
I really feel the stretch, yes.
All right, so the next thing we have her do is to bend her knee, and with the same position, all we have Nancy do is bend the knee, and exactly, so she's a pro at this. She actually gets on the ball of her foot here, and keeping the knee bent, she's able to push back, and then she's going to feel the stretch more in the calcaneal tendon. This is the true stretch for the plantar fascia and the for plantar fasciitis right here. It doesn't feel good, right, Nancy?
Oh, it burns.
But it helps a lot.
Yeah, it really burns.
All right. So
It's a good burn.
it is a good burn, exactly. So calcaneal tendons here, and also stretch out the whole calf area, the calcaneal tendon, and also all the fascia and all the tendons of the foot here. So the first thing we'll have her do is we're gonna actually spray in some biofreeze so we can get a medium to work with here. Usually I put gloves on so the biofreeze doesn't dry my hands out, but today we ran out gloves in here. So first thing we have you that we're going to work on, Nancy, on is the Achilles tendon here. And again, we're going to put a lot of pressure here, and it's pretty sore. Usually we put pressure on the lateral region and also on the medial region, so on both sides of the tendon. All right, keep breathing for me, Nancy. She's on all four right now, trying to get away from me here. So, but I will back off as the patients start to reach a pain level where they cannot stand it, because it's very, very painful. Good, Nancy. Keep breathing for me. Good. And again. Nice job. Now we're going to stretch that out after we release that for her. So with the stretching, we're going to keep the knee bent and put a lot of pressure, and she's going to feel a lot of stretch right in the tendon right there. Good, Nancy. Go ahead and resist up against me and relax me, Nancy. One more time. Relax me. All right. Breathe. Keep breathing for me. And relax me, Nancy. Nice job. So after we work in that tendon, we're actually going to go right to the calcaneus, and we're actually start to strip these muscles out here. So we're going to go straight up and down this region here and really strip this tendon and the fascia here. Lots of tendons that runs all the way to the toes. So keep breathing for me, Nancy. Good. Almost done. And again. Okay. And good. She's squirming quite a bit on me, sir. But usually patient can only last about a minute or so with these procedures that we do on them here. And we're going to give her a break and stretch it out. Good. When we did start to work on Nancy, she had a lot of pain in the medial region of the foot too, right, Nancy?
Yes, it was. Everything was painful.
Yeah,
Now
and
it's
that's-
just certain areas.
And that has really released quite a bit, and she's feeling a lot better here. But again, just right around the heel here, that's still
Yes.
fairly
It's
painful for her.
amazing the difference. Amazing.
Good. And again, push up for me right there, Nancy. And relax for me, please. One more time, please. And relax for me, Nancy. Nice job. And that's how we work on patients with plantar fasciitis. So thank you, Nancy.
Oh, thank you.
So as always, thanks for watching. Please like and subscribe for more. And if you get a moment, please check out our social media links below and our website at www.gulfshorechiropractic.com for educational health tips, information, and much more, which we think you'll love.